So I'm really delighted to welcome Dr. Yasmin Ahmadzadeh from King's College London with our first presentation. Over to you, Yasmin.
Thank you, Emily, and thanks for organising today. I'm just going to give a quite brief overview of the project that Emerging Minds have agreed to fund with my team, and it's called the Trade Project. So we'll be looking at the transmission of experiences of racism, anxiety and depression in families. And first I thought I could just introduce who's going to be working on the project, excuse me. So myself and Tolu will be the main people working on the project. Tolu's just joined us as a research assistant on the project. And we'll be supported by 3 undergraduate research assistants. So Malika, Carl and Hannah. And also Vanessa May, who's a master's student who will be doing her dissertation project with us. And Ziada and Tom, who are both experts in family mental health research, will be supporting us. So we're all at King's, although Ziada's at University of Oslo, and we'll be working also in collaboration with researchers from the Centre for Mental Health, they're a research charity. So Andrula, Alex and Kadra will be supporting us, and they've got years of expertise in conducting research around racism and mental health inequalities. So this is us who will be working on the project, and we haven't started yet, so many of us haven't really met much before, but we'll be commencing in January of next year. So just a bit of background about what's kind of led me to this research proposal. So previously my work has all been focused on trying to understand how common mental health problems, specifically anxiety and depression, run in families. So trying to kind of unpick all these different pathways that can make parents and children more similar in their mental health. And typically we tend to think about this pathway, how parents might act and behave in ways that over time influences their child's mental health. And we know that child mental health can also influence parents' mental health, and that there's a genetic component. So parents and children are also similar to an extent because they share the same genes. So trying to kind of work out and gain evidence for how these pathways operate across time is kind of what my research is focused on, so that we can better understand when and where we can intervene to prevent a kind of perpetual transmission of mental health problems across generations. And one of the chapters from my PhD thesis that was focused on this was a systematic review and meta-analysis looking at all the genetically informed research that tries to understand how parent anxiety is associated with offspring emotional or internalizing problems. And from this systematic review of all the literature that's out there, I found that over 90% of the 13,000 participating families within this literature identified as white, and all of them are based in white majority societies. So this is kind of a big problem, because we know very little about how existing work in this area that I'm in can generalize across different populations, and we know very little about the lived experiences of people who are racially marginalized in these societies. So the kind of basis for my proposal is kind of formed by these points. So UK national data suggests that parents of children in racialized groups report greater psychological distress compared to parents of white children. And in the UK, as elsewhere, racial injustice is a key contributor to mental health inequality, encapsulating higher symptom risk and poorer treatment access and outcomes for families in racialized groups. So parents' experiences of racism could affect parent mental health and behavior, and thereby exert indirect effects on child mental health. And these indirect pathways could manifest, for example, via changes in parenting or the home environment or family help seeking. And really this is what we're trying to get at in this project, and understanding these processes in collaboration with affected communities should be central in mental health research. So this is what we're hoping to start pushing towards. So if I go back to this schematic of kind of what my research and the field that I'm part of is trying to do, we're in the trade project, we're trying to better understand how experiences of racism at the parent level can be associated with child, well, at least indirectly with child mental health. So just to go through kind of what we'll actually do in the project, we're first going to conduct a literature search to see what's already out there about how experiences of racism can be implicated in the transmission of anxiety and depression in families. So this will be a kind of rapid evidence assessment of everything that's already been documented. And then we're going to meet with parents and adolescents to ask what do they think? What do the people from groups who are directly affected want to see happen in research? What do they think of our research questions and what do they want to see moving forwards? And then we're going to share what we learn and aim to kind of try and change opinions and attitudes and behaviour in research to change who our work is for and who participates. And this is kind of what our kind of core methodology is about. But another big aspect of this work is that we want to try and inspire and train future researchers to pursue research questions that platform lived experiences across communities. So this is why, or part of why we're going to be working with undergraduate research assistants on the project in the hope that they can gain some really valuable research experience and go on to pursue their own projects. And we'll also be running workshops for their adolescent participants who take part in our focus groups. So once they've been to the focus groups, we'll invite them to these workshops if they want to come and hear more about university and careers and what science and research actually means and how they can get there if it's something that they're interested in pursuing. And in terms of our timeline, I said we're starting in January, so we'll be running through to summer. And we'll be conducting the literature review, recruiting parents and teenagers for our focus groups. We'll conduct thematic analyses from those focus groups and run the workshops for adolescents and disseminate what we find to academic, clinical and community groups. So yeah, there's a lot to be doing and I look forward to sharing our progress as we go. So that's it. Thank you very much. And especially thanks to Emerging Minds for agreeing to fund this work.
I'm really delighted now to introduce our next speaker, which is Dr. Shioma-lei Craythorne, who's based at Aston University. So I'll hand over to you, Shioma-lei.
Thanks, Emily. Thank you all for having me here. This is my project. I'm here today to just talk to you about my previous PhD research and how it has developed into the project that Emerging Minds have kindly funded for me. And I'm going to be talking about racial bullying and how what some of the issues are and how I hope to address some of those issues in this forthcoming work. So my previous PhD work was all about exploring the experience of living with body dysmorphic disorder, which is a mental health condition characterized by experiencing preoccupations with one or more perceived flaws in your physical appearance. They might be very, very slight or completely unnoticeable at all to other people. And it's actually classified as an OCD and related condition in the DSM. It only affects a very small, well, they say it only affects a very small amount of the general population, 2%, but it's thought that this percentage could be much higher because of the shame surrounding the disorder, and lots of people are too ashamed to come forward to seek help because they're worried that they might be perceived as vain or invalidated. And despite that very low prevalence, it has a huge suicidal ideation rate of up to 80%. Which is awful. And within my PhD work, across all of my studies, participants recalled experiencing adverse experiences in their childhood, and that mostly included bullying, teasing, and abuse in their childhood from friends, family, peers, at school. And this led up to them developing a negative relationship with the self, extremely distorted views of how they actually look. And a lot of them involuntary, even now in adulthood, involuntarily recall vivid memories of the bullying or teasing that they experienced at school and in their childhood. One of the limitations of my work was that I only used an adult sample. And once I'd conducted all of the studies and realized how embedded these experiences were in childhood, I wanted to go on to develop the project further and look at how bullying and teasing might affect children, whether we come to the same sort of conclusions. And another limitation was my sample wasn't particularly diverse. I didn't specify that you had to be a particular race at all to take part. And because there's so little research on BDD as it is, I wanted quite a wide scope of experiences. So it's only in this project that I've decided to focus more on the racial aspect of bullying, and also linked with my own lived experience. I experienced racial bullying for a 10-year period at school, and this led to a really unhealthy relationship with my own physical appearance linked to my race. So just a bit of background for you all on what we currently know about bullying that focuses on physical appearance so far. Not a huge amount of research, as I mentioned, but there was quite a recent study led by Be Real called the In Your Face campaign. And they found that over half of secondary school aged children had been bullied for their physical appearance. And over half of those children had tried to change their physical appearance in some way to try and avoid that bullying. And those children said that the bullying had started by the age of 10, which is incredibly young to be going through such a terrible experience. But one thing I noticed about this particular campaign was it didn't focus on racial bullying. So we don't know how much of this bullying was linked to people's race or how diverse the sample was. In terms of racial bullying, it's on the rise, as we all know. But the NSPCC found that children had been contacting Childline as quite a sharp uptick of children talking about changing their physical appearance and whitening their skin to try and avoid racial bullying at school. And in the UK schools, the Guardian newspaper conducted an independent study via Freedom of Information requests. They found that over 60,000 racist incidents had been recorded in schools in 5 years. And schools don't actually have to report racist incidents anymore to the local authorities, and due to a change in government policy, which occurred in 2017. So it's thought that this figure could be significantly higher. Racial bullying has been in the headlines in recent years. I've noticed that there has been quite a lot of media interest in it recently. Some of these terrible headlines, which are entirely shocking to see, children at such a young age, and below secondary school age even. And the two headlines on the right were actually reported just last month. So it's absolutely heartbreaking to see how it's affecting children, and I just want to do something about it. So how does my previous research link to racial bullying? I don't want to say for definite that racial bullying can cause BDD, but I do have strong reason to believe it can still contribute to severely negative body image and general body image dissatisfaction. As I mentioned, there's very little research in this area. I found one study, quite a recent study, that found that racial teasing can affect the body image of ethnic minority groups. And this study was conducted in Singapore a few years ago, and the researchers found that it was the skin colour that was the main target of the bullying. But I'm also interested in other aspects of the appearance, whether it's to do with specific facial features or body, way of dressing, hair texture, things like that. And we all know that racism can affect our self-esteem very, well, terribly, and how this could impact our how we view ourselves going into adulthood and our relationship with our identity. My research project, I hope to address 3 main research questions, which will be answered by 3 components to the overall study. My first question is, I want to find out what the current literature tells us about the implications of racial bullying that focuses specifically on appearance. This research question might have to be widened out quite significantly because there isn't a huge amount out there, but I want to see what we do already know and how I can build on that. My second question, I'm interested in finding out how children, or what children think is important to consider when taking on a research project like this. Even though I have lived experience of racial bullying myself, I know that times have changed and it's very different at school now. So I want to make sure that my research is culturally sensitive and suitable for children to take part in. And my third research question is interested in how young people actually come to understand and come to terms with the experience of RMAF bullying and how this impacts on their mental health and well-being. So as I mentioned, there are 3 components to the project. The first aspect of the project is to conduct a scoping review of the bullying literature. I'm making a start on that currently, completed the protocol, which will be shared with the Open Science Framework just to register it. And from then, I'm going to develop or conduct 2 to 3 informal discussion groups with young children at secondary school. They're called project development sessions. And in those sessions, I'm hoping to talk to the children about my plans, how I'm going to conduct the interviews, just get their feedback really, any suggestions that they might have. I want to really involve them in each step of the research because the project is to benefit them and their mental health and well-being. So I want to have huge involvement from them. And then the third aspect of the project is where the children will be invited to create artwork to visually represent their experiences of racial bullying. I found in my previous work that using creative methods really helped us to access some of the previously inaccessible and internal experiences that people with BDD held within themselves. So I'm hoping that I can achieve the same sort of effect in this project as well. And it also makes it a lot easier for people to talk about their experience in an interview if they have a visual cue in front of them. And it can really help to guide the conversation. And for this project, I'm going to be using the framework for the analysis of drawings, which is the visual framework I used in one study of my PhD research. It enables the researcher to explore the lived experience of the participant in a very full and rich way. And I found that it almost acted, in using artwork in the studies, almost acted as a bridge between the concealed, which is the inner experience, and the unconcealed, which is what we hope to draw out of the children. And follow-up interviews will be analysed using interpretative phenomenological analysis, which is a qualitative research method that focuses on gaining insight into an individual's idiographic and personal lived experience. And then I'm going to take both forms of the analysis at parallel and analyse them together at the case level to try and see if I can identify any commonalities before generating themes. And this is the framework for the analysis of drawings for those of you who might not be familiar with it. It's a 15-item framework. Highly recommend it for if you're going to be working with visual data, it can be artwork, photographs, whatever it is that you're using. And I found that it was a really beneficial tool for looking at the artwork and creative data in a more deep and thorough way. And there's just some references for various articles that I've mentioned in the presentation, and I'm happy to answer any questions that you might have. Thank you all for listening.
I'm really pleased to welcome Dr. Verity Jones from the University of the West of England.
Hi, hopefully you can see the screen. Yes, thanks ever so much for inviting me to talk today, and again, thanks very much for Emerging Minds for funding our research, which has got the snappy title of Improving Wellbeing and Mental Health Relating to Racism in 10 to 11-year-olds, a Bristol case study. We didn't really think about having a really snappy acronym when we were writing the bid. So when we're working with the children, we are calling it the WARP project, which is Wellbeing and Racism project, just so that it's not quite so such a mouthful. But I think what is important for us to note here is that we are Bristol based. The whole team is Bristol based. Bristol is really important at the moment for Black Lives Matter, the toppling of Colston here. We've got the Jen Reid statue as well. Bristol City Council have estimated that we've got 5,600 5 to 16-year-olds that have diagnosable mental health issues, but we have no data recognising whether racism is a contributor to that. So we've got all sorts of really interesting things going on in Bristol, which I think makes our work and using Bristol as a case study really interesting. So we know that children experience racism, and earlier this year, new research commissioned by the Diana report reported that 32% of a poll of 1,000 children had heard some form of racism in school, and that was for 6 to 15-year-olds. But what's missing from that is, what's the impact? Okay, so they're hearing it, but what's the impact of it? It's also widely recognised that racism impacts health, and there is growing evidence that it's a psychological stressor. But again, a majority of the research has been with teenagers and adults, and the younger people, as we've just heard, younger people are reporting that they have memories of things starting as early as 10. I've been talking to people recently, and they've got memories of when they're 4 years old, of being told how they've got dirty hands, even though they've gone and washed them at nursery and kindergarten, and all sorts of things that memories that have really stayed with them. So our work is based on two premises. First of all, we need a better understanding of institutional and interpersonal experiences of racism and how these are made sense of by younger people. We also need to recognise that the mechanism of influence on mental health for these younger people may not be the same as adults. So that's where we're going to come in from. Our team is made up of 6 people. We've got a mix of research experience and disciplinary expertise. So to begin with, we've got Chris. He's head of psychology here at the university and has experience of working with children and young people. Justin is a senior lecturer in primary education. He's previously a teacher and a member of the senior leadership team in socio-economically deprived areas of multicultural constituencies of London and Bristol. He's also recently begun his PhD on decolonising the curriculum. I was really excited to hear the aspects of art in your work, Shioma-lei, because we've got Lucy on our team, and she is a socially engaged artist and is really leading our team in thinking about how we can engage in art-based practice. So Lucy's got lots of experience of working with groups on the margins, both adults and children alike. And myself and Sarah have worked with Lucy on a couple of other projects, which I think really feed into what we're doing, even though they're perhaps not about racism per se. So the first one was the dry work that we worked on, and that was responding to a knowledge exchange project where we were taking knowledge and misconceptions about drought in the UK, which you might not think about it today as it's dipping it down with rain, and climate change, and considering how we can package that to support children's mental health and eco-anxieties. So we co-authored this, and it's free. It's a free downloadable book and teacher's notes, and that won the Geographical Association's Publishers Award last year. So Lucy and I are also working on the VIP Clear project at the moment as well, and that very much looks at COVID recovery from 3 to 11-year-olds. So again, we're always working in the primary sector, and has taken an art-based approach. So we've been doing all sorts of art-based workshops with children, doing deep mapping, analysing those maps. So we're using these techniques and bringing them into our new project. So as I said, Sarah, she's also in primary education. She's an experienced teacher. Her recent doctoral thesis was unpacking pedagogies relating to sensitive and controversial issues. And we're really interested in that idea of how do we teach, how do teachers engage in ideas of racism and supporting children about that. Tessa is another psychologist with experience of working in schools, and then that leaves me. So like Sarah and Justin, I was previously a teacher and a senior leader in school, as well as years of working for charities and local governments on issues of social justice. So using the experience of the team, we'll be drawing on art, as I said, as a method and of inquiry and as a communication tool with 10 to 11-year-olds. So we're working with this far younger age bracket than's previously been worked with. Art, as Shioma-lei said, you know, it's that non-verbal route to engagement, which addresses some of the concerns that I know previous Emerging Mind workshops have raised. So the research questions that we're looking at are: what are 10 to 11-year-olds' experiences of racism and how do they impact mental health and well-being? And because of our context, we're also looking at how, knowing about this, how can our teacher trainees, so our teachers of the future, contribute to contribute to the reduce the impact of racism on mental health and well-being. So what can we do in teacher training to prepare new teachers for this, as well as teachers who are already in schools? So we have a pilot phase which we're in at the moment. So we're working with our expert panel from our local community and council advisors, as well as students and teachers. We're meeting with them, a literature review, and also working with a school where we're trialling the methods that we're going to be using in phase 1. In phase 1, we then go in and we're working with another 2 schools in Bristol, and the approach that we're taking is we do a workshop that's led by Lucy and observed by 2 members of the team, and then after the workshop we are doing focus groups with the children and interviewing staff. So that's kind of what phase 1 is about, all of the time listening to children's experiences, their understandings and their identifications of potential mental health issues and well-being issues and concerns. Then phase 2, we then take all of that and work with the young people in school. So again, making sure that we've got young people's voice throughout this, and work on how we can package something for our trainee teachers. And with those young people, we deliver to our trainee teachers a toolkit for how they can go into schools and be more confident about teaching and facilitating discussions about racism and racism education and anti-racism education. And then we're evaluating that process as well. So the pilot stage at the moment is that we're preparing to go into schools, and the arts-based part of the work through consultation is we're looking at body mapping. So using something quite familiar, a strategy that's used quite familiar in Thrive Education, and encouraging the children to think about those feelings, reactions and coping strategies within the body, and then those experiences that are coming in externally and how those are managed. So we're really looking forward to working with the young people on that. So the outcomes hopefully will enable young people to explore their own understandings and experiences of racism, which is really important, giving them an opportunity to discuss that and how it impacts them. We also hope to improve better services in schools by feeding into the local belonging strategy, as well as doing CPD events for schools. Our university will be has committed to embedding the toolkit into the ITE programme, and it will be received by almost 300 PGCE and third year students this year. So that's 300 schools that will hopefully benefit from what we're doing here, as well as chapters, conference papers and so forth. So I hope that gives you a taste of the kind of things that we are preparing, and thanks again for inviting me to discuss it.